In the words of Marcus Tullius Cicero, the face is the picture of the mind, with the eyes as its interpreter. This statement implies the very essence and importance attached to the human eye. On today's edition of Better You Today, we shall be zeroing in on cataracts. According to our resource person, Dr. Nasiru Danjuma Simon, whom you shall get to meet in a while, cataract is a silent thief of sight. Do you know this visual impairment is reversible? This and more will come your way on today's episode. My name is Yetunde Jayola. Don't go anywhere, we will be right back. Thank you for staying glued to your screen. Next on our lineup is a special report x-raying the various professionals complementing each other in the care of the human eyes. Do not go anywhere.
The eye are spatial organs that require utmost care for one to enjoy his vision and attend to basic needs of life. There are various dimensions of eye care, and these include vision and eye health. Helping the individual to see clearly constitute the vision category. It comprises the eye care practitioner to examine your eyes, to carry out tests if it would benefit, to recommend and adopt the use of glasses or contact lenses. The eye health category is primarily focused on managing eye diseases and disorders. They often prescribe medications for the patient or carry out surgeries aimed at impinging positively on the health of the patient. Various eye care professionals. Ophthalmologists. They are medical doctors that specialize in the diagnosis and treatment of eye diseases, disorders, and injuries, having received extensive training in medical and surgical aspects of eye care, which typically qualifies them to undertake a wide range of eye surgeries. Optometrists. They are professionals trained in the university to test vision and prescribe vision correction solutions like glasses and contact lenses. In most countries, optometrists are also trained to detect eye diseases and other health issues that may affect the eye, such as diabetes and hypertension. Orthoptists. They are professionals that specialize in the non-surgical treatment of eye muscle disorders that typically affect how the eyes work together, referred to as binocular vision. They perform various diagnostic tests to determine how and whether the eye align with each other, and based on their findings, they develop treatment plans that typically include specific exercises and prescribing prism lenses that bend light to overcome eye alignment issues. Occupational therapists. With respect to eye care, is a professional assessing visual and perceptive deficits that affect daily activities and occupations. They team up with other eye care professionals to provide comprehensive care for people with visual impairment. Optical dispenser or optician. This is someone who helps people select and fix eyewear and other vision aids to meet their visual needs and preferences. Aside from fixing and dispensing spectacles, they also perform repairs, adjustments, and maintenance on eyewear. They also advise people on proper care and use of their eyewears. Ophthalmic nurse. This is registered nurse who works specifically in providing care to patients with eye diseases and disorders. They work closely with ophthalmologists to provide comprehensive eye care services to patients. They help with patients' assessments, administering eye drops, assisting in eye surgeries and procedures, and educating patients on surgical aftercare and eye health.
you find one or two things to take away from that report. It's now time to meet our guest on Better You Today. He is Dr. Nasiru Danjuma Simon, a consultant ophthalmologist at the Wuse District Hospital here in Abuja. He speaks extensively on cataracts. Please watch.
Cataract is just the opacification of the lens. Now, if you look at this model of the eye, the first thing you see when you look at the eye is a membrane that covers this part of the eye we call the conjunctiva. That's the first thing you see there. So immediately after the conjunctiva, the white part of the eye is what we call the sclera. Then that black thing you see, that black round thing is the cornea. This cornea, that is glassy and is very, very transparent. So when you open the eye, this is the cornea, that is the outer part. The next thing you meet when you remove the eye is what we call the iris. This is the iris of the eye. Now the iris gives the eye its color. In black people, it's either brown or black. In white people, it can be blue, it can be green. So this is what gives the eye its color. So the hole in between the iris is what we call the pupil. That is where light passes through. So light passes through the cornea and then passes through the pupil. And then what you have behind it is what we call the lens. This is the lens of the eye. That is the one that is next to, just behind the iris. That is the lens. And our topic for today is cataract, and that is where our main focus will be. That's on the lens. The lens is right inside the eye. These two organs that are transparent, the cornea and the lens, are responsible for all the refractive power of the eye. So every light that is coming in through the eye passes through the cornea, is refracted, passes through the lens, is refracted. When I use the word refraction, what it means is that they have the ability to channel the light to where it should be, at the back of the eye. So if one of these is missing, either this or this, you discover that the ability of light to be focused on the back of the eye, which is the retina, is affected. The lens is a biconcave structure. So light passes here, comes out of here. So it's supposed to be transparent. So once you start developing cataract, what you mean by cataract is that the lens now starts becoming opaque. It starts becoming turbid. It's no more transparent. So one thing with cataract is that it can occur in any part of the lens. The anterior part of the lens, the posterior part of the lens, the middle part of the lens, which we call the nucleus, can be affected. And they could become opaque. So if it's the anterior part that is affected, we say it's an anterior capsular cataract. If it's the posterior part that is affected, we say it's a posterior capsular cataract. If it's the middle, which is the nucleus that is affected, we say it's a nuclear cataract. Now, each and every one of them have their problems differently, the way they present. So immediately after the lens, the next thing you see is a liquid. There is a jelly liquid in the eye, which we call the vitreous. In fact, this jelly liquid gives the eye its shape. It's what maintains the shape of the eye. So if anything happens to this liquid tomorrow and then it is off, the shape of the eye is usually distorted. And it's also transparent. The semi-liquid is also transparent, so that light can pass through to this part of the eye we call the retina. You can see the retina has blood vessels. Now this thing you see that comes out of the back of the retina is what we call the optic nerve. This one gets to the brain and get connected to the brain. So that any image that is coming here is interpreted by the retina and then sent to the brain. So it is the brain that tells you what you are seeing. So that is just the basic structure of the eye. And the eye, they say, you can be likened to a camera, the retina being the film, and all these are just for focus. And the good thing about the eye is that if you look at the human eye, one important thing there, the pupil is very important because it is the pupil that actually controls the amount of light that enters the eye. This small hole you are seeing there, that's why when you shine a torch on the eye, that hole constricts because the eye doesn't like much light. The pupil constricts, it becomes smaller, so that just very tiny bit of light can enter. Then when you are in an environment where there is no light, the eye opens because the light is not enough, it's looking for light. You see that place is dilated. It is said that in this environment, in fact, our environment, in fact, in the world per se, cataract is one of the, in fact, it's the highest cause of reversible blindness in this environment. When we say reversible, it means the blindness from cataract can be reversed. Being the highest cause of reversible blindness in the world, I think it's followed by glaucoma. Cataract is the opacification of this lens. And usually when you have opacification of this lens, it becomes in stages. It can be very small, it can be big, it can be small. The one way of categorizing cataract is where you find them. If it's anterior, we say it's anterior cataract. If it is middle, we say it's nuclear cataract. If it is behind, we say it's posterior cataract. The same thing too, you can have cataract affecting the whole of the layers of the lens. That we call total cataract. Another way you can also classify cataract is based on chronology. Children are born with cataract. So once the child is born with cataract, we say that is congenital cataract. If you find cataract in a child between the ages of 1 year to 2 years, we say it's infantile cataract. If you find cataract in a child between the ages of 1 year to 13 years, we say it's juvenile or developmental cataract. If you find cataract in a child that has grown between the ages of 1 to 49 years old or so, we say it's a developmental cataract. Then when you find cataract in those that are age 50 and above, we say it's a senile cataract. So you can classify cataract based on chronology. Then you can also classify cataract based on causes, based on etiology, what causes cataract. So you'll be talking of things like trauma. Trauma, when you have trauma to the eye, can cause cataract. There are certain drugs that when you take can cause cataract, especially the pregnant women. There are certain drugs like thalidomide and others they take during pregnancy that can cause cataract. There are certain maternal infections during pregnancy, things like toxoplasmosis, cytomegalovirus infections can affect the child, and the child can come out with congenital cataract. There are some syndromes that are associated with children that can make them also have cataract. For instance, now, like children with Down syndrome, cataract is common among them. There's what we call the Edwards syndrome, and there's what we call the Patau syndrome. Those children too, they are prone to having cataracts. There are some metabolic diseases that the children may have that may also predispose them to having cataract. One of them is diabetes. The other one is what we call galactosemia. These are conditions that can actually predispose children to cataract. Then for adults, so apart from trauma, there are also drugs that adults can take that can predispose them to developing cataracts. Some of those drugs we will include, there are drugs that are used to treat arthritis, gouty arthritis, like Perinol, that can cause cataract too. Then adults that are on steroid medications, steroids that you take by mouth, either by mouth or by eye drops, can also predispose them to developing cataracts. Then another predisposing factor that is also of note is smoking. Smoking has been attributed to actually cause cataract. People that work in industries, like what we call the glass blowers, people that make glasses, a lot of infrared rays from this thing can also affect the eye and cause cataract. Even people that are exposed to what we call ionizing radiations, like people that are exposed to X-rays in the hospital, people that have certain kind of tumors that probably are going for radiotherapy, so they can also be exposed to such rays. They can also cause cataract. When it comes to management of cataract as a whole, when the patients come here, we tell them that we want to look at the cataract by classifying them into either mild, moderate, or severe. Now, those with severe cataract are those that have the vision has actually gone, we call them what we call visuals, least significant cataract. Then the ones that are mild. So there is a primary level of prevention, there is a secondary level of prevention, there is tertiary level of prevention. But in this our environment, yes, we could do primary level of prevention, but we discovered that the secondary level of prevention is not common here because of some of the equipments that we don't have. And the way the patients present here, most of them present with severe cases of cataracts, so you just have to treat them severely. For what we do for the mild cataracts and the ones that are mild, just we counsel the patients with them, because when we say cataract is mild, it's not as if the vision has gone down. It means the cataract is small, so they can still see from the side of the eyes. So we don't rush to do surgery for such. So what we do is just we advise them as per what they should do. If some of them have the risk factors, we tell them what they like. If you smoke, we say please stop smoking. If you are on any drug that we feel precipitates the cataract, we'll let you know. And then we'll let you know and tell you that if you please don't use such drugs because they will precipitate cataracts. If they are exposed to any kind of chemicals in their workplace that is causing the cataract, we'll let them know. And if they have any disease that will expose them to ultraviolet radiation, we want to let them know too, so that they prevent it. Now, some of them, the vision at that level may be reduced. So what we'll do is that we may do a refraction for them. There's what we call refraction. We refract them. If we see that glasses can help improve the vision a bit before the cataract matures, we'll give them glasses. So most of them will be on glasses. Then there are some that we can also place on certain eye drop that will keep the eye dilated so that they can be seeing clearly and be doing their day-to-day work while we monitor them to see when the cataract will mature. Then for the secondary prevention, that is when you now do surgery, even when the cataract is still very small. Based on expertise, there are surgeons that are so good with their surgeries that can actually attempt to do surgeries for even cataracts that are not mature. So yes, those ones can be, but there are not many.
Thank you for staying tuned. How often do you pay attention to what your eyes are telling you? Listen to your eyes and visit a specialist if need be. But before we say our goodbye, here are some essential tips that are germane to proper eye care and health.
Most humans are concerned about care of the skin, hair, and even feet relative to seeking important tips on care of the eyes. This is not good enough considering the impact our vision plays in our everyday life and overall human existence. Some might say that taking care of your eyes seems pointless if you do not have any vision problems. However, adopting a few easy habits will not only preserve your vision, but will also decrease your odds or probability of developing eye problems in the future. Here are some simple, smart ways to help keep your eyes healthy. Eat a balanced diet. It is recommended to eat a variety of food for eye health. Eating assorted fruits and vegetables, fresh green or yellow leafy vegetables, helps in providing vitamins that impact positively on eye health. Exercise regularly. The eyes need oxygen to stay healthy and comfortable. Experts say that aerobic exercises can increase crucial oxygen supplies to the optic nerve and lower pressure in the eye. Wearing sunglasses that block ultraviolet radiations. Exposure to sunlight can damage your eyesight and increase the risk of developing cataracts, age-related muscular degeneration, inflammation of the cornea, keratitis, or corneal growth such as pterygia and pinjeculae. Getting a good night's sleep. A good night's sleep can help keep your eyes feeling bright and refreshed. Lack of sleep and fatigue can lead to your eyes becoming sore, irritated, puffy, red, and bloodshot. Limit your exposure to digital screens. Many people spend long hours using mobile Android phones, tablets, and laptops every day. These devices emit high-energy blue light waves that can impinge or impact negatively on your eye over time. If hazardous or airborne materials are in use in your place of work or at home, ensure you wear safety glasses or protective goggles. This helps with the protection of the eye. Avoid or limit the amount of alcohol consumed. Drinking too much alcohol interferes with liver functions, reducing the level of glutathione, an efficient antioxidant that can help protect against common eye diseases. Don't smoke. Experts posit that smokers are twice as likely to lose their eyesight in later life than non-smokers. Tobacco chemicals damage the blood vessels behind your eyes and increase the risk of developing age-related macular degenerations, AMD. Wash your hands before touching your eyes. Before touching your eyes, experts recommend that you wash your hands with mild soap and dry them with a lint-free towel. This is because germs and bacteria brought into the eye by the fingers can cause eye infections and can even introduce cold and flu viruses into the body. Have regular eye examinations. Experts recommend that adults between the age of 18 to 60 visit their eye doctor at least once a year to undergo a comprehensive eye examination. This is so important because some eye diseases may not have warning signs. But with regular examinations, eye care professionals can detect these conditions in their early stages when they are easier to treat before there is any vision loss.
In the words of Ralph Waldo Emerson, one of the most wonderful gifts of nature is a glance of the eye. It transcends speech. It is the bodily symbol of identity. That is all we have for you today. I hope this edition was revealing, informative, and fulfilling. Kindly visit our social media platforms displayed on the screen for feedbacks and access to previous episodes of the program. My name is Yetunde Jayola. See you next time.